and that it's important that we all, as visitors, support their struggles and resistance that overlap a lot with immigrant and refugees. And I think they introduced already sanctuary health, but I just gonna add, before I play some recording of two people that are our friends that live here without documents, that I think it's important to honor those voices. Instead of me being here and talking, they will give you a better sense of the stories and the struggles that they face. But Sanctuary Health got together in June of 2012 after they announced the interim federal health program cuts for refugees. And we got together just to fight back these cuts. But throughout the conversations that we had, a lot of, we acknowledge there's a lot of other people that also don't have access to health, including temporary migrant workers and undocumented people. And we try to redefine our understanding of health, also seeing the layers of all the social determinants of health, access to housing, access to employment, all the stressful immigration process, and how this affects the health of immigrant refugees and undocumented people. And so in the short term, we're trying to create spaces also to support the short-term needs of people that are facing the impacts of these cuts, and as well as trying to advocate at a policy and political level to fight back the cuts and advocate for access to health for all. And then I'll talk a little bit more about it afterwards, but I want to play these recordings. They are videos, but we're just going to listen to it because we couldn't make this work. There's a password. It's not working, the password. Felipe. Thank you.
It's a long password.
I know, it's not. Thank you.
No van a mostrar el video.
Let me know if the sound
Hello, my name is Maria. I came to Canada as a temporary worker, and I'm facing some challenges about my health because I got pregnant 4 months after I came to Canada. And that was a really tough situation to me because I was asking help for give birth my baby and I couldn't get it. I was paying my insurance, I was paying my taxes, and they say that they cannot help me. And I was in my 8th month and I couldn't have no doctor to take care of my delivery. I just was lucky because I got a midwife and we were deciding applying for in case that I cannot get medical insurance. And at the same time, I was applying for get extension of my work permit through my company. And happened is 10 months after, my company just decided don't sponsor me, don't help me. So I just was in Canada with baby and with a broken promise of help like a worker. And also about the medical service, all the time they just ask me about my NSP card and I didn't have. And they just say like, if you don't get your immigration paper done, you cannot get any medical coverage. So my baby was over 6 months Canadian, but without medical care card. So I couldn't take my baby to the doctor. Thanks that nothing happened and she was healthy. but I think that it's really important, the initiative about Sanctuary City, because we are coming to Canada to work. We are working here, we are living here, and sometimes we don't have documents, but even we are paying rent, we are buying cell phone, we are buying food, we are buying clothes, and we are paying taxes in some way. We are helping the economy. But when we are facing problems about our health, we cannot get any help. Even paying our taxes, even trying to help the economy growing up, we are not getting that. So I really would like that the government can help the people that come here or that live here, even without document, but they are helping Canada to become a better country.
Hi, my name is Anna. I'm from Mexico, and I came here to Canada as a tourist in 2007. So I've been living here for over 6 years. Initially, my plan was just to come and visit for a few weeks, but then I just started meeting people. I like so much the city, and I decided to stay like for a few months, just to get to know the city better. And in the meantime, I just got like the chance to start working, because that way I could stay more, visit more places, and be here spending more time and knowing the city. In Mexico, I study law, so I'm a lawyer. But then when I started working here, I just got caught in an easy way to get money, because you just ask for a job. I work in construction, so you just phone somebody, ask for a job, and then you have a job for the next day. And as a construction worker, you get like good money. So I just decided to try it and be here working. And then the time just passed and passed and passed, and I didn't want to go back to my country because it's really dangerous now, and there's not much employment opportunity over there. Even before I came to Canada, I was looking for a job as a lawyer, and most of the jobs I got offered, they pay me each month less than what I was spending on my education. So it's like it's not like really good paid, my job over there. The main challenges I've been facing here is first getting used to like labor job, because I was not used to doing like labor job. My job was more like intellectual and kind of stuff. So it's been a challenge, because you have to use your whole body to work, and you're not used to, so you just get tired. One of the other challenges I think we face the most is like the fear of being always thinking and when immigration is gonna come and when they're gonna deport me, or if I do this or if I do that, I'm gonna get in trouble. So you're not allowed to even defend yourself from people that may wanna hurt you. For example, if you are in a dangerous situation where you want or you need to call the police because somebody wants to hurt you or something, you cannot call them, because when you call them, they're gonna ask you for your ID, and then are gonna realize you're undocumented here, and they are gonna turn you to the CBSA, and then you're going back home. Probably sometimes with no chance to even pick up your stuff and just get rid of everything and get ready to go back home. A few months ago, I went out at night, and I was with some friends waiting for a cab, and then was this guy that just punched one of my friends, and he couldn't even talk to the police or call them or defend himself, because he will be like in real danger calling the police. Instead of feeling safe, he was feeling insecure because of the police. As well, you face many challenges like in housing. Recently, I have an issue with my landlord. He didn't want to pay my deposit, my damage deposit back. And I was really afraid to go to the tenancy branch and start like a complaint over there because of my status. I didn't know if I was going to get in trouble, if they wanna call to the CBSA or the police, or they wanna research more about me. And sometimes you just decide to lose the money or not defend yourself, and just your human rights are totally vulnerable here because nobody can help you. And if you look for help, it's worse. So that's like really, really bad. Another thing is that here, you're not allowed to get sick. Because if you get sick, it's gonna be really, really expensive for you. If you go to the hospital just for emergency, you just have to pay like $700 up front so they can check you if you're injured, if you have something. If you have a cold or you feel sick or something hurts, you just have to pay like lots of money to get checked back by a doctor, and then you have to pay like really expensive medicine or treatments. So here you're just taking care of yourself the best way you can and try not to get sick and being really careful on what you do, because getting like any medical assistance is really, really hard. And when you go there, sometimes if you're really, really bad injured, they have to call the police. And again, there's the same issue with the police. You don't feel safe, and you just decide not to take care of yourself. Finally, I think it's really important that Vancouver becomes a sanctuary city, because this will allow people like me to access to the services of health, to access to public security. You will be feeling more safe calling to the police if someone wants to hurt you. You will feel safe if you're working and your boss doesn't want to pay you, then you'll be able to claim for your money that you work for. And people with kids or babies, they will be entitled to go to school and study and get prepared for life.
Yeah, so I thought it was better to listen to these voices rather than listening to me, but I just want to add a few things about related to the links that Hilo was talking about. We as a Sanctuary Health also don't know if a Sanctuary City is the solution or one of the solutions, or how it would be implemented, and we don't necessarily think that it should be only approved by the council to make it happen. We know about many people that are working really hard to provide the services, and that there's some people in the community that provide services to undocumented temporary workers. So but we also know that if Sanctuary City is a way to shifting the mentality of how everyone deserves access to basic services, and everyone has the right to access these services, and if these conversations happen through the movement of Sanctuary City, I think we believe in this type of conversations, and we also don't know how it would look like, but we also know that it should happen regardless of becoming a public policy. Like all service providers and community organizers and people in that community should change the mentality that there's different categories of people that deserve certain things. And one of the things that we talk about in Sanctuary Health a lot is that we want to engage health professionals in realizing that not providing services according to what category of person or how much worth you are is a political act. Because we also believe that nurses and doctors and healthcare workers think that that the services they provide are apolitical, but just not providing is a political statement. And we also don't think that they should be put in this position of becoming immigration guards and not working ethically and with integrity and providing healthcare for everyone. So yeah, we just, if there's something that we want to ask of everyone right now is just to help us change this. First of all, understand better the challenges and the complexities and the different journeys of undocumented people, immigrant people, refugee people, but also understand how all these different cuts and all these different policies just, what they're doing is just making us think that there's better people than others, that there's these categories of human beings. So just by normalizing the idea that everyone deserves access to fair access to services, and also creating the spaces for these communities, as Gil said, not leading the communities, but creating the spaces to these communities to talk about the challenges and come up with strategies, and then just supporting and implementing these different ways of the immediate needs that they have, but also in the long term, and help be supporting with the organizing. And yeah, something else that I'm just gonna add before, because I promised I would do this, that I'm also part of an incredible group of young people that are launching their campaign called Make It Count, and I've been really fortunate to be part of it. And we got together for 3 years, and we engaged other immigrant and refugee youth across the province and talk about what were the challenges that immigrant and refugee youth and their families were facing, and came up with 16 recommendations. And the campaign is called Make It Count. So I invite everyone to go to the campaign. And there's 2 people here from this group, Pablo there and Jorge in the back. And we have a petition. There's 16 recommendations, and one of them is related to Sanctuary City in the sense of access to education and health services to all children and youth in the province. But the main recommendation that we are pushing is very simple. We're asking the Minister of Education to give credits for graduation to high school, immigrant and refugee high school students. So there's an online petition, and at the end, Pablo and Jorge will be outside. You can sign the petition today.